This is your tendon. Strong, robust, durable, and adaptable.
So maybe not quite your tendon, but this does a really good job of giving you a visual of what a tendon looks like. So let's talk about tendons, particularly when you have tendon issues. Most of us think of tendonitis, meaning an acute just happened tendon inflammation. But usually it's more of a tendon-OSIS, meaning it's been going on for a while, it's kind of degenerative, and it's just fraying just a little bit, as you can see in this rope. It happens to us all, and it's not always the worst thing, but it does take time to heal because tendons don't have as much blood flow like muscles. Think about muscles, they're really red. That's because they have a lot of blood and a lot of oxygen going to them. So when you have an injury, it heals up fairly quick, even if it's a really bad injury. Now with tendons, it takes a little bit of time and you have to really load them. What does that mean? Let's get into it.
So loading the tendons, right? Now you're already thinking, what are you talking about? I have shoulder pain or knee pain or Achilles pain or foot pain. Well, if it's deemed that it's tendinopathy or tendonosis, which often is seen by when you start activity, it's really painful, but as you warm up, it usually gets a little bit better and then lingers and feels really crappy the day or two after. More often than not, what you really need is to load that tendon. So that might mean that you need to load it with a certain weight, right? Or maybe you're a little bit heavier than that. Whatever it is, it needs to meet the demands that you're placing upon it in a heavy, slow, resistance exercise way. If your shoulder has a tendinosis or tendinopathy issue of doing slow, heavy arm raises overhead like so to address the pain that you're having in the front of your shoulder. Now it seems counterintuitive, I know, that when you're having pain, you actually load it more. Well, if it's deemed to be tendinosis, then yes, they crave load, and even times it can be analgesic or make the pain feel better by loading it in the correct way and dosing it appropriately gradually over time. That's why whenever we talk about tendons and tendinosis and tendinopathy, we talk about loading it with weight consistently. All right, just to kind of summarize up, if you start to have a tendon type pain in your shoulder, knee, or other area that is acute, or it comes on all of a sudden after a huge increase in exercise or work, that might be more of a tendonitis type issue where the pain is acute, it has a lot of inflammation, and at that point we want to slowly calm things down and then gradually build back up with exercise and loading the tissue. Now if you had it for a while, it's been more on and off, a chronic type of issue that we've been talking about with the tendon, well then that's the case where we really need to start loading it really aggressively, and that the pain that you have with that is usually acceptable somewhere between 3 or 4 out of 10 pain for that. That's a different story than the itis. So you have the itis that's short term that we need to calm down, build back up gradually, and then you have the osis that's more long term that we can be a little bit more aggressive about loading appropriately and gradually over time.